The Federal Ministry of Health has disclosed that it has concluded plans to introduce malaria and human papilloma virus into the routine immunization program in Nigeria to boost the healthcare of the population. The Minister of Health, Dr. Osagie Ehanire, announced the development at the first quarterly meeting of Northern Traditional Leaders Committee on Primary Health Care Delivery Health in Abuja, saying routine vaccination is a free service that is compulsory in all primary healthcare centers in Nigeria. Dr. Osagie, while urging mothers to bring their infants in for the vaccination at the appropriate time, added that it is crucial for protecting babies from various diseases and enhancing their quality of life.
According to real estimates, 60% of all ailments can be handled at primary care level. And we were charged, when I say we, I'm talking about the Ministry of Health, we were charged to create a balance along the tiers of healthcare. We have primary, secondary, and tertiary healthcare, and we have just recently introduced the emergency medical service and ambulance system, which is to be able to respond to citizens when they have an emergency medical problem and they need help most. The number is 112. It is being piloted in Abuja as we speak, and we are developing the software that will allow us to take 4 more states on to pilot it and learn from it, so that with that call, you can get medical care, medical attention, and transportation at no cost to the user at point of care. So the importance again rests on the fact that the poor health indices for which Nigeria has not felt very comfortable in maternal and child mortality and morbidity, which they are not very good. But these are generated largely in the rural areas where there is no access to any form of health care. And we need to do more in terms of getting the incoming administration not to deviate. And philanthropy is also to continue to invest in, again, primary health care. The routine immunization, of course, as we know, is a free service at primary healthcare center where they exist. And if they are everywhere, it is better for us. The immunization is free, it is safe, it is effective, and it's available for all citizens. Now, parents and caregivers need to be mobilized to ensure that children receive the vaccination according to the Nigerian routine immunization schedule. As I said, the immunization is important for preventing disease. In fact, the most important preventive measure for a whole range of diseases. Once you are immunized, as we have noticed now in the case of COVID-19, the ability of the body to resist the illness from that particular ailment goes down. We shall also very soon be trying the malaria vaccine, for which we have applied, Nigeria has applied to receive the malaria vaccine, and that will also be introduced here, as well as the application and also the permit now to be giving the human papilloma virus vaccine also, which, as we know, is implicated with cervical cancer, one of the most common cancers that bothers our women. So the vaccination is going to be introduced against those things. So we shall have a healthier population if we're able to, one, educate people generally on water, sanitation, hygiene, advise mothers on nutrition and diet, provide routine immunization, handle all vector-borne diseases, and also waterborne diseases, vaccine-preventable diseases, and we shall have a far, far healthier and more productive population.
The outbreaks of diphtheria that we've seen in Jigawa, in Lagos State, are indications of how weak our routine immunization system is. Yes, we've made progress in the last 5 years, but that progress is not enough to make sure that we eradicate these vaccine-preventable diseases. This is why your voice, which carries so much power in our communities is very, very important, so that as we carry out the campaigns, we are able to ensure that community members take their kids for vaccination in the health facilities. And this is why over the next 3 months, we're going to try to cover up the gap by conducting intensified routine immunization campaigns in February, in March, and in April to try and close the gap and reach those kids that we've missed so consistently. So as of today, we have been able to vaccinate over 78 million Nigerians with at least the first dose of the COVID-19 vaccine. That represents 68% of the eligible population. We've also been able to vaccinate over 58 million Nigerians, representing about 58% of the eligible population. That is huge. States like Nasarawa, like Jigawa, like Kaduna, like Kano have pretty much covered the eligible populations, and now we're looking to ways of routinizing it. But we know that while the interest is on COVID-19, we are also using the opportunity to couple it with other primary healthcare services so that we're not making the same mistakes in the past when we used to offer only polio vaccines. Now we're saying you can have COVID-19 vaccines, but here are some other additional packages of services that we know you have expressed the need for.
Review meetings are important because they afford us the opportunity to discuss our scheduled activities for the period and beyond, with a view to assess progress made, challenges faced, share good practices, and exchange ideas with oversight agency officials and development partners. It is also an avenue to learn about new programs and initiatives of our government that requires our buy-in for the overall development and well-being of our people. We are therefore always happy to attend and contribute our best in the discussions and the implementation of the resolutions.